If you're struggling with fatigue, you're going to want to know what we're going to talk about today, because we're going to be discussing a way that you can actually combat fatigue by using a treatment option that is non-traditional. Hi, I'm Dr. Arland Hill, and I see a lot of patients that struggle with fatigue, and one of the big causes for this that's not commonly recognized as a cause for fatigue is going to be H. pylori or Helicobacter pylori, which is an infection in the stomach. Now, when someone is diagnosed with this, most often the recommendation is going to be what's known as triple therapy, which is generally 2 antibiotics and an acid blocker. And there's a couple of concerns with that because those just aren't as effective as they have been in the past. I'm going to show you why that is. And it may also suggest as to why you want to consider an option for treatment that extends outside of that, or it is not really looking at these traditional options as the primary strategy for addressing your H. pylori. Now, keep in mind this H. pylori, it negatively affects your ability to use B12, it negatively affects your iron status, so it can be a big cause for fatigue, and if it's not being assessed, then you may be at risk for this. It's pretty prolific. We all have H. pylori, but whether or not it is friendly to your body or whether or not it's an infection has a lot to do with what's going through the gut. So make sure you check out my other video for that, where I detail that and where I give a lot of detail about that. But for today's conversation, I want to make sure that you're looking at this the right way, because just looking at H. pylori with a blood test or a breath test, that's really not the best way to go about that anymore. We know a lot more about H. pylori, and now today it really comes down to whether or not the H. pylori is expressing something called a virulence factor. Now, virulence factor is just a problematic protein, is really all that comes down to. So if your H. pylori is expressing this problematic protein, you should be alerted by that, because that's even been associated with things like gastrointestinal cancer, gastric cancer, stomach cancer. So you really want to know whether or not it's expressing these virulence factors. Here's the other thing, and this is what we're seeing a lot of now, and one of the reasons you should be thinking outside of just antibiotics as an option for doing something about your H. pylori, and that is that there's a lot of resistance out there now. This is something I'm seeing far more commonly, and unless you're seeing DNA or unless you're using DNA to assess your H. pylori, you're not going to be able to see these antibiotic-resistant genes that are so prevalent. So if you're using medications, traditional medications or traditional antibiotics to try to address this, they're probably not going to, some of these are probably not going to work because you have these antibiotic-resistant genes. So it'd be great to know whether or not you have them so you can choose a non-traditional option. There's some great approaches to this. Things like what's classically known as vitamin U or mastic gum. These are great options to be able to address H. pylori, and that are very effective in a short period of time. So listen, guys, if you're struggling with fatigue, take a deeper look. See if H. pylori is your problem. If it is, think outside the traditional box. Find a doc who can help you see whether or not those antibiotic-resistant genes are something you should be factoring into your protocol. Hey, listen, if you like the information, make sure you share this information with someone else and give me a like down below so we can get it out there to others. Thanks for listening, guys. I'm Dr. Arland Hill.